everyone. Look, I want to talk tonight about community dispensing of HIV meds, and it's really great to see so many pharmacists in the audience here tonight because we're really excited about this. We've been advocating for this for 12 or 15 years, and finally it's happening. So sooner or later, somebody with HIV is going to walk into your chemist shop and they're going to say, can you possibly dispense my antiretroviral medications? And you're going to be faced with that process. So I want to talk a little bit about that and some of the background behind how this has all come to happen. So the first thing I want to talk about is why this happened, why it was necessary. The second thing I want to talk about is some of the survey findings that, so we did some surveys around New South Wales but also around Australia to get an understanding of how many people were interested in getting their medications dispensed in community pharmacies and what the barriers might be for them around getting their medications dispensed. And finally, I want to identify some of the incentives and barriers around this sort of dispensing of HIV medications in New South Wales community pharmacies. So, as you're probably aware, the Minister for Health, the Federal Minister for Health, it was then Mr Dutton, announced towards the end of last year that S100 S100 drugs, or highly specialised drugs, were going to be able to be dispensed in community pharmacies, and that included HIV drugs and some cancer drugs and some other drugs. And the reason why this is so important is because in the old days, as you know, they were only dispensed in hospital pharmacies, and that's because the guidelines for highly specialised drugs stipulate that. But as more and more people have regained their health because of antiretrovirals and the incredible impact that has on people's health, they've gone back to work, and having to go to a hospital pharmacy during 9 to 5, Monday to Friday during business hours is really inconvenient for a lot of working people with HIV. So providing better access so people can get to a pharmacy in the evenings, at the weekends, is going to improve uptake of antiretroviral medications, but also it's going to actually normalise the whole process. We formed, when we knew this was going to happen, we formed an advisory group with some pharmacists on it, with some hospital pharmacists on it, with people from the Ministry of Health, people from the LHDs, people generally in the HIV sector, to work out how we could make this run nice and smoothly, to remove as many barriers as we could, to inform people about what they needed to do, both the pharmacists but also the people with HIV, generally to smooth it out. And there's been a really important, or there's going to be a really important announcement very soon. So in the lead up to the state election at the end of last year, the Baird government made a commitment that they were going to waive the co-payments for highly specialised drugs. And what that's going to effectively mean is when that comes in, that HIV drugs will be able to be dispensed free of charge, and the patients will go to, when they go to their doctor to get their script written, they'll sign a consent form which allows the government to pay the co-payment to the federal government, and they'll be getting their drugs free. And the federal minister, or the state minister for health, will be making an announcement around that in the not too far distant future. So that's quite an exciting development, and what that's going to mean is it's going to remove some of the financial barriers for people who are on low incomes to actually get their antiretroviral medications and keep taking their antiretroviral medications, because we know if they do, they remain healthier and they reduce the risk of transmitting HIV to other people. So we're trying to get the rates of HIV transmissions in Australia down to very, very low rates, and part of that is around getting people on treatment early, getting their viral load under control, and then reducing their risk of transmission. So this is one of the surveys. We did a survey in New South Wales, we did a survey nationally around the country, and the only reason I'm showing this slide to you is to show you that some of the demographic information was slightly different between the national survey and the state survey. In the state survey we had more people who were older, who were on the DSP, who were on low incomes, who had high rates of comorbidity. Now probably not employed, so therefore the rates of the rates of people who wanted to go to a community pharmacy in the New South Wales survey would probably be higher if we had a more a balanced group of people like we did in the national survey. So this is where they lived, and you can see in the national survey there was a good representation from Queensland. Because we'd done the New South Wales survey, we didn't have that many people, but there were people from the ACT, from South Australia, Tasmania and Victoria. Victoria ran its own small survey as well. So we had about 1,000 people from Australia who answered the survey, and that's, when you consider there's about 27,000 people with HIV in Australia, that's a reasonable sample. So, this is where they get their health care, and I won't go into that too much, just to say that most people are on antiretroviral medication, so out of all the people who answered the survey, only less than 3% are not taking antiretroviral medication, so most are, the majority are. And most have been on treatment for more than 3 years. Some have been 20%, so 21% had been on treatment for 1 to 3 years, and there was a small percentage that were just starting treatment. So what did the survey say? Well, it told us in the national survey, which were, well, first of all, I'll talk about the New South Wales survey. It happened in October last year, and this was all still very new, and the news was starting to filter out to community that this was going to happen. And what they told us was that about 65% of people were willing to actually go to a community pharmacy and get their HIV drugs. Now, if you consider there's 10,800 people in New South Wales, that's a reasonable number of people. But there was a group, about a third roughly, who said, I want to stay with a hospital pharmacy, I want to continue to go there, and there's a range of reasons why they did that. In the national survey, which happened in February, so there was a 3 months lag between when the New South Wales one happened and when the national one happened, nearly 80% of people said, I'd be happy to go to a community pharmacy and get my antiretroviral medications. But there was also about 20% who said they didn't want to do that, and we'll talk about the reasons why they didn't want to do that. And the majority, just about everyone, 100% said it was around access and convenience. So being able to go there at night, being able to go there at the weekend, normalising the whole process instead of having to go to the hospital and get their medications there. So for the people who didn't want to go to a community pharmacy, you can see that the greatest concern was about other people knowing their HIV status. And as you know, there's a lot of stigma and discrimination around HIV, and some people, particularly heterosexual people, but particularly people from culturally and linguistically diverse backgrounds who are heterosexual, have real issues around this, but also gay men too. So in the rural areas, people are particularly sensitive around other people knowing their HIV status, and they have sensitivity and sort of concerns about walking into a pharmacy and saying to the chemist, can you dispense my antiretroviral medications? Because the pharmacist is going to know they're HIV positive and the news might get out. So confidentiality is a really important thing to build trust between you as the pharmacist and the people you're actually dispensing to. Some of the people thought that the current situation worked for them, so they're quite happy to continue on going to a hospital pharmacy. They've got a long established relationship with the hospital pharmacy and the service is good, so they'll continue to go on there. And some of them actually collect their medications after they see their doctor, so they'll continue in that hospital-based process, while the majority will consider moving across to community pharmacy. So how do we get all this information out there? We produced some electronic brochures and some news feeds and some articles, and they were set out throughout the country, and the other states actually used our information and piggybacked off our information to get the information out to their consumers in the other states. We also worked with ASHN, which is the Australasian Society of HIV Medicine, and it's just changed its name to include hepatitis, and the PSA, to develop resources for pharmacists, and they're available on our website, and there's a range of other resources which will be coming out very, very soon around the co-payment waiver and what that means for pharmacists and also people with HIV. So the advice that we gave to people with HIV was from the 1st of July, you can go into a pharmacy, a community pharmacy, and get your HIV meds dispensed. The scripts need to be dated on or after the 1st of July, you need to discuss your expectations with the pharmacy. You know, there's not many pharmacies who stock all the antiretroviral drugs. In fact, there's very, very, very few of them. You'll probably have to, if somebody comes in, you'll have to order them. So it's important to go in, not run out of meds, say, I need this dispensed. Can you do it? How long will it take to order? Get the drugs. Are you prepared to do it? But just have that conversation with the pharmacist. And usually, a lot of people, if they are sensitive about their HIV status, it's probably a good idea to take them to one side and just talk to them quietly about what they want to do. And to plan ahead. So if the agency or the pharmacy doesn't have stock on the shelf, they need to order it in to give the pharmacy enough time to get that stock in. So the advice to the pharmacist was that hospital scripts have a new dispensing code, and that can be used now at community pharmacies. And as at the 1st of July, there are relevant PBS streamlined authority codes for each of the HIV antiretroviral drugs, and there's a website with all those streamlined codes. There's been some issues for pharmacies setting up accounts with wholesalers, particularly those who are doing, there's a couple of pharmacies in the Darlinghurst area that are doing really big numbers of scripts. So these drugs are expensive, so you can imagine that the amount of credit that they're actually carrying per month can be quite large. So it's been a bit difficult for some of these pharmacies to establish accounts with those wholesalers and establish ongoing lines of credit. Currently there's about 100 New South Wales community pharmacies that are signed up across the state to do this, and it's amazing. There's lots in the inner city. There's some in the surrounding suburbs in the Sydney metropolitan area, and there's a good range of community pharmacies up and down the east coast. Quite a lot in the Northern Rivers area, but quite a lot along the coastal strip. Once you go into Western New South Wales and Southern New South Wales, not so many, because probably the demand isn't going to be very high there, and the populations of people with HIV are pretty low. So most of this pickup is going to be in the inner metro area. And we've got a blog going on our Choice is Yours website, on the Positive Life website, where people can feed back to us how they're experiencing this whole process. And overwhelmingly, everyone thinks this is fantastic. They're saying they're going into a pharmacy, the pharmacy is treating them with absolute respect and discretion, they're being able to get the drugs, it's a breeze, it's fantastic, they love it. So it's a really good news story. So a bit of information about people with HIV, so you've got a bit of background. So first of all, as I said, there's about 10,800 people with HIV in New South Wales in 2015. About half are accessing antiretrovirals and they're on limited incomes. So 41% are waged, but you can see that about 44% are on the DSP and some are on unemployment benefit. And the other thing that you're probably going to get asked is around drug interactions with other medications, because people with HIV have high rates of multimorbidity, they have mental health conditions, they have high rates of cardiovascular disease. There's some people, or a minority of people, who have some neurocognitive impairment. There might be things like liver and kidney disease, which are pretty rare, but generally the rates of comorbidities are higher, and a lot of people with HIV are on medications for other conditions, chronic health and complex conditions. So you may be asked around if there's going to be drug interactions between the HIV medications and the other medications that they're taking. So it'll be interesting, I think, for you to be able to discuss those things with people as they come in. The social aspect, so we've talked about stigma. If HIV is a pretty stigmatised disease in the general community and people are wary about disclosing, so there's going to be some sensitivity when they come in, particularly to places like chemists, because they're pretty assured in healthcare services that their confidentiality will be maintained. But in a chemist shop where they might be dealing with not the pharmacist but one of the staff, there may be some issues there. So we talked about the fact that people are concerned about other people knowing their status, and They're also concerned about pharmacists not being able to help them with that drug interaction issue of HIV and non-HIV medications. And that's it. Any questions?